October is Breast Cancer Awareness Month.
Yeah, Dr. Nita Landry from The Doctors joins us to talk about ways to reduce the risk and give back at the same time. Thanks so much for joining us.
Thank you for having me.
First of all, you're saying that women need to know their own breasts.
Yes.
And what does this mean exactly?
Oh my gosh, this is so important. So self-breast awareness. Know your breast. Know what's normal for you. What do your breasts normally look like? What do they feel like? Because when you know what's normal for you, you can tell your doctor when something changes. And also realize that not every woman with breast cancer presents with a breast lump. Of course, some of them do, but some women don't have a breast lump. Instead, they'll notice skin changes in the breast area or skin dimpling, inversion of the nipple, just a lot of different things. And those things don't always mean breast cancer, but they always warrant a conversation with a healthcare provider just to make sure.
And it means being proactive, obviously, with your own health, right?
Exactly, exactly. Being proactive. And, you know, it's also important to know your family history. So a lot of times when a woman gets breast cancer, no one in her family has breast cancer. It's totally sporadic. But there are some instances where there's a hereditary reason. And so if you know your family history, you can tell your doctor, oh, my aunt had breast cancer, my uncle had breast cancer. Or you can say, you know, there was some ovarian cancer. And notice I said my uncle had breast cancer. That's a big one. A lot of people don't know that male breast cancer is possible. It's less than 1% of breast cancers. But when it happens, it's very concerning. So knowing your family history is very important.
There's also some advancements in treatments that you might want to talk about, right?
Yes, exactly. So we're learning more and more every day, and we're all just sitting here waiting for the day we can cheer when there's a cure for breast cancer. But in the meantime, you know, we are making advancements, and the mortality rate is decreasing overall. For example, early detection. Early detection is so beneficial because some of these women won't need to have a mastectomy, meaning removal of the breast tissue. Instead, they can have like a breast sparing surgery where the abnormal tissue is removed, and then there's radiation around that area, so they're able to save the breast. And also, there are different things coming up like cold caps. So a cold cap is basically when a woman is using chemo and she puts a cold cap on her head, it decreases blood flow to the hair follicles, and as a result, they can lose a lot less hair. So lots of advancements.
And doctor, we want to talk a little bit about reducing risks, and we have a graphic on that, letting people know exactly what they need to do. What do you do to reduce some of the risks?
So, you know, diet is always a big one. So, you know, just lots of fruits, lots of veggies, and also
Alcohol. Don't drink as much.
Don't drink as much, yes, compared to women who don't drink. Women who drink 3 drinks on a regular basis per week, 15% higher risk.
Wow, and of course, work out regularly. That's the answer to a lot of things.
Those are tips we can all use. Doesn't matter, right?
Yes, works for everything.
Dr. Nita, thank you so much for joining us.
Yeah,
and you can watch The Doctors weekdays at 2 p.m. right here on CBS 2.